The human body is an incredibly intelligent and sensitive system. Every small change can be a signal that something is happening beneath the surface, perhaps a mild imbalance, or the early signs of a more serious illness. Many people overlook these seemingly minor symptoms, only realizing the seriousness of the issue when the body begins to speak up through more pronounced signs, often when it's too late for a simple solution. Learning to listen to your body is a vital life skill. It requires attention, self-respect, and a basic understanding of the signals your body sends each day. This article will help you recognize 10 common yet often ignored health signals messages your body sends that you must never overlook if you want to live a healthy, peaceful, and fulfilling life. 1. Persistent fatigue. A red flag from within. Fatigue is something everyone experiences from time to time, but when tiredness lingers for days or even weeks, despite adequate rest, it becomes a cause for concern. Persistent fatigue isn't merely about being overworked, it's often a sign that something deeper is going on inside your body. Common causes include anemia, thyroid disorders, hormonal imbalances, immune dysfunction, vitamin B or D deficiencies, chronic fatigue syndrome, or even early signs of heart or liver disease. When your body loses balance in energy metabolism, exhaustion becomes constant, regardless of sleep quality or duration. Start by reviewing your lifestyle. Ensure 7–8 hours of sleep per night. Reduce caffeine, avoid late nights, and maintain a balanced diet. If the fatigue persists, seek medical advice and request a thorough health screening. Your body doesn't collapse without reason, it's trying to tell you that something needs attention. 2. Poor sleep quality. A signal from your mind and body. Sleep is the body's most powerful and natural form of recovery. When sleep becomes shallow, frequently interrupted, or difficult to initiate over an extended period, it can take a serious toll on both physical and mental health. Sleep disorders lead to fatigue, decreased concentration, memory loss, irritability, and increased risk of anxiety or depression. Causes vary from psychological stress and hormonal changes to medical conditions like sleep apnea, circadian rhythm disorders, or deficiencies in nutrients like magnesium, calcium, or tryptophan. Rather than relying on sleep medication, focus on building a sleep-friendly routine. Go to bed and wake up at the same time daily. Reduce screen exposure before bed. Avoid heavy meals late at night. And limit caffeine in the evening. Sleep is not a luxury, it's a necessity. Treat it with the care and respect it deserves. 3. Frequent headaches. A warning from your nervous or circulatory system. Headaches are one of the most common symptoms people experience, yet also one of the most overlooked. Many rely on temporary painkillers without seeking to understand the root cause. However, recurring headaches may indicate dehydration, poor circulation, high blood pressure, vision problems, sinus issues, or even nerve inflammation. Headaches that are accompanied by nausea, blurry vision, numbness, slurred speech, or loss of consciousness could indicate an impending stroke and should be treated as a medical emergency. Preventative care includes staying hydrated, correcting posture during work, managing stress levels, and undergoing regular health checks, especially blood pressure monitoring. Light exercise, such as walking or yoga, can also improve circulation and reduce headache frequency. Don't ignore recurring pain, it's your body's way of asking for help. 4. Digestive disturbances. Signs of an internal imbalance. Your digestive system often reflects your overall health. Symptoms like bloating, indigestion, constipation, irregular bowel movements, or abdominal pain should never be brushed off as minor discomforts. These could signal more serious issues such as gastritis, acid reflux, irritable bowel syndrome (IBS), colitis, or even early-stage colon cancer. Digestion is also tightly linked with mental health. Stress can directly affect gut function, making emotional balance just as important as diet. When you're anxious or emotionally overwhelmed, your digestive system tends to suffer. Maintain digestive health by eating on time, chewing food thoroughly, reducing processed foods, increasing fiber and probiotics, and minimizing sugar and trans fats. If symptoms persist for more than 2 weeks, especially if you notice blood in the stool, unexpected weight loss, or ongoing discomfort, seek medical evaluation. 5. Unexplained weight loss. A sign of metabolic or systemic disorders. While many strive to lose weight, a rapid or unexplained drop in weight without diet or exercise changes should raise immediate concern. Such weight loss may indicate metabolic issues like hypothyroidism, diabetes, chronic infections, liver disease, or even undetected cancer. When your body is unable to absorb nutrients or burns calories abnormally, it begins to break down muscle and fat reserves. Over time, this leads to physical exhaustion, lowered immunity, and serious health complications. Monitor your weight regularly. If you notice changes accompanied by poor appetite, nausea, digestive issues, or sleep disturbances, consult a healthcare provider promptly. Early detection through basic lab tests can make all the difference. 6. Changes in skin, hair, or nails outer signs of inner imbalance. Skin, hair, and nails are not just aesthetic features, they're external reflections of your inner health. Sudden dryness, flaking, discoloration of the skin, hair loss, or brittle nails may indicate nutritional deficiencies, hormonal disorders, thyroid issues, or liver and kidney problems. These changes can also stem from stress or a poorly balanced diet lacking essential nutrients like vitamins A, E, B7, and minerals such as zinc and iron. Care for your outward appearance by healing the inside. Hydrate well. Eat a nutrient-rich diet. Reduce sugar and saturated fats. Get quality sleep and manage stress. Don't just treat the symptoms with cosmetics, address the root causes from within. If needed, seek medical tests to identify any deficiencies or imbalances. 7. Chest pain and shortness of breath, critical signs that demand immediate attention. Among all bodily signals, chest pain and shortness of breath are two that must never be ignored. Whether it's a dull ache or a sharp, fleeting sensation, these symptoms could indicate heart issues such as angina, heart failure, or heart attack, lung problems like pneumonia or emphysema, or psychological conditions such as anxiety or panic attacks. Pain that radiates to the left arm is accompanied by sweating, nausea, dizziness, or a sense of impending doom must be treated as a medical emergency. Every minute counts when it comes to heart-related symptoms. To prevent such conditions, regularly monitor blood pressure, cholesterol, and blood sugar levels. Avoid smoking. Maintain a healthy weight. Engage in gentle exercise, and manage stress effectively. Don't wait for a crisis to begin taking care of your heart. 8. Discomfort in the upper abdomen, a potential sign of liver or gallbladder. If you ever felt bloated, experienced indigestion, or dull pain in the upper right part of your abdomen, especially after eating greasy foods, or noticed yellowing of your skin or eyes, or dark-colored urine, and simply dismissed it as fatigue or poor diet, don't ignore these signs. They could be early warnings of conditions such as hepatitis, fatty liver disease, gallstones, or gallbladder inflammation. The liver and gallbladder are silent but vital organs, and when they send out distress signals, it's time to act. Takeaway: if you experience symptoms like persistent discomfort or tightness in the upper right abdomen, yellowing of the skin or eyes, loss of appetite, fatigue, or dark urine, consult your doctor and request liver function tests or an abdominal ultrasound. 9. Hand tremors or balance problems, possible neurological warning signs though your hands tremble slightly even when you're at rest. Have you found yourself losing balance, tripping easily, or walking with less stability? These symptoms could indicate a neurological disorder, such as Parkinson's disease, cerebral dysfunction, poor circulation to the brain, vascular issues. Tremors caused by hunger or stress are common, but unexplained tremors accompanied by slowed movements or difficulty balancing should not be ignored. Takeaway: do not dismiss signs like hand tremors, imbalance, or slowed movements. Seek a neurological consultation early to check your brain and nervous system health. 10. Excessive thirst or frequent urination, a possible sign of diabetes. Do you find yourself constantly thirsty, no matter how much you drink? Are you waking up multiple times during the night to urinate or experiencing unexplained weight loss? These seemingly minor signs may be early symptoms of type 2 diabetes, a rapidly growing global health concern. Takeaway: watch for symptoms such as unusual thirst, urinating more than 7 times a day, fatigue or unexplained weight loss, slow healing wounds. Get your blood sugar checked as soon as possible. The earlier diabetes is detected, the easier it is to manage. Your body is never truly silent. It constantly communicates through feelings, changes, discomforts, and signals that may seem subtle at first. When you learn to listen, you give yourself the chance to heal, to grow, and to thrive. Health isn't just about curing illness, it's about nurturing your well-being every single day. Don't wait for pain to teach you what self-care could have prevented. Let each day be a practice of awareness, compassion, and connection to your body. No one can care for you better than you can. And no one knows you better than your body. It has always been speaking. It's time to truly listen. If you found this video helpful, don't forget to hit the like button to support the channel. Share it with your loved ones, because sometimes recognizing a small sign at the right time can truly change someone's life. And make sure to subscribe so you won't miss future content about health, healing, and living more fully each day. Thank you for being here. May you always hear the gentle messages your body and life are trying to share with you.